Hello everyone and welcome back. My name is Erin and I'm here to help you find your path to your best emotional and physical health, as well as address some issues regarding healthy aging, which is going to lead us into our topic today. So before we get into that, I just wanted to remind you, don't forget to subscribe if you like the information you hear today, to find out some of the different things that are coming out as I explore opportunities to improve our overall health and functioning. Also, don't forget to download my 5 free videos on your tips to finding your best emotional and physical health. So with that, I would like to get started. Just today is going to be a quick overview on kind of what the next series is going to be about. So I kind of didn't want to give too many hints right off the bat, but this is something that I'm really passionate about because I find it very fascinating in today's world as I work with a lot of health issues and kind of figuring out how people get to where they are as they age. So I kind of became interested in cognitive decline for the past couple of years as I noticed changes in my own thinking and the way that my thought process worked and the way my brain functioned, and really kind of being aware of that. And then I started to look around me, and as I was testing a lot of people for cognitive decline, I started really kind of looking at what looks to be like this kind of rise in Alzheimer's and other types of dementia. So that's kind of how I got interested in figuring out, okay, what really is going on here, and is this preventable? Because there are so many people with cognitive decline, and it's always comorbid with other issues like insulin resistance or blood pressure issues. Chronic inflammation, which a lot of people have, and all of these things, of course, start way earlier than you start seeing the actual cognitive issues. The other thing that we see a lot is zinc and vitamin D deficiency. Hello, that contributes to why we're having problems with our immune system and why we're having a lot of problems succumbing to infections and things like that. That's why coronavirus is starting to affect people, and why all these kind of problems, those comorbidities we call them, contribute to a lot of deaths when we're faced with some of these ongoing health things. There's also things like ongoing viral loads. Sometimes there's people that are exposed to herpes, HIV, all kinds of things can contribute to cognitive decline if not properly managed. Sometimes people get Lyme disease, which if that kind of bacterial and viral infection continues unabated, then it can cause some cognitive decline as well. There's a whole host of things, especially things our environment, such as toxic overload, exposure to chemicals, exposure to mycotoxins, which is code for mold in our environment. One would think that's not a problem here in Colorado. Believe it or not, it is more than we think it is, because we get a lot more rain that gets trapped in the summer into our environments and in our basements and things like that. So it's more of a problem than we are aware of, and most people don't even know that it's an issue. They don't even know they have mold exposure. So one of the things that I started thinking about is, okay, as there is this, pressure to treat these kinds of diseases, and I'm like, why do they not figure out how to treat Alzheimer's disease? Why have they not done it? And why are they not preventing it? Because that really becomes the issue, is that we want to be able to prevent some of these things, but they're best prevented through lifestyle management and the monitoring of some certain tests. Now, that can be a problem because people don't want to, well, I shouldn't say people, I should say the insurance companies don't want to pay for prevention. And they don't pay for prevention because what they're doing is and this was based off of an interview that a doctor that was doing some of this research said, that a CEO admitted that people change their insurance companies every few years. So if they are working on prevention, they are helping their competition. So why would they do that? So that's a big issue, right? Because I was like, why wouldn't it be cheaper to prevent than it would be to treat? Well, there's additional issues with treatment as well. Treatment of something like Alzheimer's and cognitive decline is really multifactorial, as you will find as we kind of go through these things. And to think we can treat it with a single drug is just not possible, especially if we don't really truly know the source. And there's been some challenges with identifying these particular drugs. I think the number I heard was 400. There'd been something like 400 drugs tried for FDA approval and in blind studies, but most of them are not effective, and that's because they treat only one part of the overall picture of brain health, and without addressing the other parts, there's no way to prevent cognitive decline. So what we're going to go over is kind of the overarching issues and the overarching principles around cognitive decline, and this is based on some work done by some very preeminent neurologists, because there is an extreme disconnect right now between what is going on maybe in the research worlds, either at universities or sometimes in bio companies, and what is going on in our medicine. And people have admitted that sometimes cutting edge isn't passed on to the doctors because the doctors are taught medicine the way it currently is and what's currently proven. So they don't necessarily look at some of the emerging science that is trying to put out there some new things because they're not covered by insurance. So it makes it hard for them to treat them. It's like these ideas are great, but I can't do these for my patients, which puts the poor doctors in a double bind because they can't treat the patient the best that they know they probably can based on some of the limitations put on them by the industry. So we'll talk about some of those things that may or may not be covered and what we can do to take charge of our own health regarding that. So there's 45 million people in America that will likely develop Alzheimer's disease in the next 10 or 15 years. And it could come from several different sources. So we're going to kind of talk about how we can monitor our cognitive health early on, such as starting as early as 45 to 50, I think is the best time to do it, to just kind of see where you're at. And there's some real simple ways to do that and just to kind of maintain your overall health. If you have other issues that are contributing to or possibly could contribute to cognitive decline, you can do it even earlier. So if you have diabetes or if you have high blood pressure, those kinds of things kind of can be markers of potential cognitive decline in the future. So that's a brief summary of what we're going to go over in some of these next few videos. It's going to take some time because these are kind of complex subjects, and I don't like to go very long, and I like to kind of just give you brief snippets of what we can look at without overwhelming you with too much information. So if you like what you hear, please pass this along and don't forget to subscribe. If you think you need some coaching on how to manage some cognitive issues and how to get some lifestyle changes in order to enhance that, please don't be afraid to connect with me on the website and set up some time of your own. Again, have a great day, and I will talk with you later.